Okay, so we're live on Facebook and we are recording this session as well. And we'll give it one more minute to get started. All right, 4 o'clock on the dot. We are recording this session and this is also live on Facebook. And so we will post the recording tomorrow of this session. It's 4 o'clock and we're going to start. I want to welcome Deputy Chief Medical Health Officer Dr. Mark Lecision here today, as well as Superintendent of Schools Patrick Bocking to answer your questions. And so how this is going to work is on the bottom of your screen. If you have a question, you can ask in two ways. One is you can raise your hand and then I can offer you the mic to speak to ask your question. And otherwise you can ask in the Q&A box. You can type in your question and we can answer it that way. And we will read them out for the panelists to answer. If you are viewing this on Facebook, you could also type in your questions there and I will have a look there as well. Or you can email us at questions@sd46.bc.ca. And so I'll be checking those different locations too for your questions. All right. Dr. Mark Lecision, please take it away.
All right, thanks a lot. So I'm Dr. Mark Lecision, Deputy Chief Medical Health Officer for Vancouver Coastal Health and also one of the Coastal Region's Medical Health Officers. I just wanted to start out with a little bit of an overview of the outbreak in the Vancouver Coastal Health region, and then we'll talk a little bit about school COVID safety plans and how we hope to keep kids safe as they return to school. So as of yesterday, we were up to about 3,100 cases in the Vancouver Coastal Health region. We are in what we would describe as a second wave of the pandemic. And we are having high numbers of cases right now, about kind of 50 cases per day in the Vancouver Coastal Health region. One thing that I will note, though, is it's difficult to compare this wave with the first wave, because if you remember back to the first wave, we actually had a very restrictive testing strategy, and we were only testing people who were healthcare workers or people who were being admitted to hospital or lived in long-term care. And so although the numbers of cases right now seems high, we have to remember that we were testing many fewer people before. And so we actually believe that the first wave had a lot more cases in it than we are seeing right now. But now we're able to count the cases because we have a very permissive testing strategy and we have a lot of capacity to do testing. The cases that we're seeing now are also quite different than the cases we were seeing before. The cases now are younger. They do have more social contacts because we're not in the lockdown phase that we were in before. And so we in public health are doing a lot of work to do contact tracing to find out where the cases have been and to isolate their contacts. And now that the school year has started, we'll be doing that in the school system as well. Luckily, we have a great relationship with school districts because we do this work regularly in the school setting around pertussis and around measles and around other communicable diseases. And this work with COVID is not really that different. What's different, I guess, is that there's a lot of attention on it. And, because it is a pandemic and it is a new infection, that there are a lot of cases that we're dealing with right now. But one of the goals of the public health measures that we implement is really to protect the population and protect the healthcare system so that if people are sick, they can be treated within the healthcare system. And during the first wave, we had very aggressive lockdown measures. We closed businesses and closed schools, and those measures did contain the first wave of the outbreak, but they had a lot of negative consequences on society. It was difficult for people to earn money. It was difficult for kids to learn. It was, the measures had a lot of harms. And so we know that this infection is going to be with us now for years, and we can't, keep using those type of lockdown measures. They're just too harmful on society. So basically, what we need to do now is establish these COVID safety plans to allow society to function understanding that there will be COVID cases in settings like schools and workplaces, and we have to be able to manage them. So, the first wave, we saw a lot more hospitalizations, harm, and death that came associated with it compared to now. Like if we look at the proportion of cases that were hospitalized during the first wave, 20% of cases were hospitalized, as opposed to 3% of cases now. 3% or 8% of cases required ICU admission, and now only 1% of cases require ICU admission, and finally 10% of cases during the first wave resulted in death, whereas only 1% of cases right now result in death. So even though we're experiencing this second wave, we are, managing to reduce the impact on the overall population. And since fewer people are being hospitalized and admitted to the ICU, there's also preserving the capacity of the healthcare system, so we can continue doing surgeries and we can continue offering all the healthcare services that people need. So the COVID safety plans that have been implemented are working to protect the population and also to protect the healthcare system. And so that's why we're able to keep things open, open schools, and have people be at work, because we are managing to protect the population and manage to protect that capacity of the healthcare system. The other thing I'll say about the cases that we're seeing, and this has been sort of a characteristic throughout, is that we do know where most people get their infections. So most cases we're able to connect schools and have people be at work, because we are managing to protect the population. And oh, sorry, I just heard a little recording. Because we do know where most cases get their infections. So right now about 57% of cases we can link to a known case or to a known cluster or situation where the event where there has been transmission. And then another 5% of cases are linked to international travel. And then we have about 20% of cases where we don't know where they got them. And those are, what we call community transmission. So, even though we are having some community transmission right now, most cases we still know where they got their infections. And when that happens, those cases are typically isolated once they develop symptoms, and they don't spread their infection even further. And so that's the process that we want to carry out in schools as well, where there is a case and we isolate their contacts, and then we prevent transmission to the greater school community. So I guess that gets us to the COVID safety plans. So these are the plans that have been implemented across society to help reduce the chance that COVID will be transmitted in different settings like workplaces, but also in schools. And so the most important part of the COVID safety plans in schools are the policies which basically keep sick teachers at home, and so they can still be paid if they're at home. And then the policies that keep kids that are sick out of the school system, because basically if we can keep sick people from coming to school, then there's much less chance that that COVID will spread in the school. But of course, that's not the only measure that's in place. We've also got cleaning protocols that will reduce the chance that COVID could be transmitted through surfaces. It can't eliminate that chance, but it will reduce the chance. And then kids have also been grouped into classes and cohorts, and so that basically their contacts within the school can be reduced. And that way, if we have to isolate people, it's a little bit easier for us to determine who should be isolated, and we don't have to take sort of aggressive measures to isolate an entire school. We can, at least at the beginning, isolate smaller numbers of kids, because we do know that isolating somebody for 2 weeks is actually a big infringement on their personal freedom and their ability to engage in activities and social life and things like that. So we don't want to do that to more people than have to, but obviously the people that are exposed, we do want to isolate them. So I guess it's good for us to explain the process that we'll go through when there is a case in the school district, because COVID-19 is a reportable disease, and so every case is reported to the health authority. And whenever we get one of those cases reported, we'll contact the case, we'll inform them of the diagnosis, and we'll ask them to isolate. We then figure out who their close contacts are, and that includes their household contacts, any intimate or sexual contacts. And Then we figure out where they've been while they were infectious. And so if they've been in the school setting while infectious, we're going to have to determine, well, what classes have they been in? What were they doing in those classes? Who were they sitting next to? Who were they talking to? Who did they play with on recess? Who did they hang out with after school? Was there any activities after school? And so we go through those questions for the entire time that they were infectious before they entered isolation. And so depending on the age of the child, we're able to do that with the child themselves. Sometimes we need to do that with the child's parents. Sometimes we need to contact the teacher to figure out what was actually going on in the classroom. And then based on that, we assess who has been exposed and is at high risk of developing COVID. And then we contact them and we ask them to isolate. If it's a small number of people and we're able to contact them directly through a phone call to let them know that they need to isolate, then we don't do any public notifications about that. But if it's a larger group, like an entire class or a learning cohort or an entire school, then we will usually do that through a letter that's distributed through the school that will explain who needs to be isolated and the process for doing that. And so when we do issue one of those letters, then we do post a notification on our school exposures webpage to let people know that there has been some COVID measures applied to that school, so that the whole school community does know about it. So yeah, so that's sort of the process of if there is a case in school. So maybe with that introduction, we could go over to questions. I saw that some have been coming in. I haven't been able to read them though.
Did you want me to read them out to you, Mark? Because some have come in from Facebook and I've put them over.
Okay, yeah. Why don't you sort of
Sure.
choose the order?
Yes. Have there been COVID cases at Elphinstone High School?
All right, so I mean, I can't in a forum like this comment on specific cases. That's not what we're here to do. We're here to kind of, basically talk about the protocols and the safety measures. So, we haven't posted any notifications around Elphinstone High School on our COVID school notifications website. I can tell you that.
Why are children in the same classroom where physical distancing is not possible not considered close contacts?
Right. So it will depend. So for every case, we do interview them to determine what kind of interactions they have had during their infectious period. For this condition, the interactions that we're looking for is unprotected face-to-face contact within 2 meters lasting longer than 15 minutes. So that's the type of contact that we believe puts you at highest risk for developing COVID. And so basically we interview people with those criteria and try to determine which people they have had that type of contact with. And it can be one 15-minute encounter, or it can be multiple instances of, say, 5-minute encounters that add up to that amount. And so we interview people to determine when they have that contact. There's other possible ways that it can be transmitted too, such as through surfaces. And so if people are sharing a common surface, such as, there's multiple children sitting at the same desk, for instance, we would usually consider them close contacts as well. But some of this, also does depend on the age of the child. Obviously, younger children, there's not an expectation that they would be physically distant and that they could be. With older kids, there's more ability to do that. So we'll interview the case to determine how much they were able to remain physically distant from other people in the class. And we may also interview the teacher for their observations of the degree to which children are being physically distant in their class. But it also depends on how many class sessions the case attended during their infectious period. It may just be one class session and we can really get into that session. It may be several class sessions, and then if they're sitting next to different people in each class session, or they're doing different things in each class session, at that point it starts getting more difficult not to isolate an entire class. But it really is very, very specific to that case. So in some cases, particularly with young children, then a whole class might be considered contacts. But it really depends on the child, on the situation, just like it does in every situation that we manage in workplaces or in public.
Next question we have here is, can you please address what the high school students are expected to do during their lunch break? At Elphinstone in particular, there is nowhere for the kids to eat safely. They are sitting crowded in the hallways.
Okay, so
Something that,
yeah, so I mean, I'll start with this and I'll pass some of that over to Patrick. You know, for young kids, we don't expect them to be able to be physically distant. And as they get older, we expect them to be able to do this to a greater extent. And so that's part of it. The next thing is why we're not relying very much on physical distancing in the school setting. Physical distancing is really a measure that we've applied when people are out in public, and it's meant to prevent a stranger coming up to you within 2 meters of your personal space and coughing and sneezing in your face, because that's how you might get COVID from a stranger. So we maintain physical distancing from strangers in public in order to prevent that type of transmission. But in the school setting, when you're around the same people on a daily basis in the same locations, that possibility of them coughing and sneezing in your face is less of a risk, because you're also all contacting the same surfaces, touching doors, touching the tables together, and you're in contact with each other in other ways. And so that's why we also don't recommend physical distancing necessarily between office colleagues that work together on a daily basis. It's just not that important a strategy, and to kind of forcibly implement it in school could have harms as well. And so basically now we have a measure that's not that effective in the school setting, and it would be difficult to implement, so we don't recommend it. So so that's a little bit about physical distancing, but now we're getting back to the high school students at Elphinstone. So it really depends, are they in the same learning cohort? Are they friends that are part of the same social circle? So those are all questions that will determine whether they feel comfortable being close to each other or whether they don't. And so that we see in society outside of schools as well, where some groups of friends decide to sort of be in each other's bubbles, and other people decide not to and have a much smaller bubble. So people have to make some of those decisions on their own. To what degree are they willing to accept the risk that COVID could be introduced into their bubble? And then they might become a case, they might have to isolate because they're a contact. Other people in their bubble might become infected. So that's something that everybody does have to struggle with a little bit. But I'll let Patrick talk a little bit about the situation at Elphinstone.
Sure, and thank you for that question. I haven't been at Elphinstone at lunch specifically. I have been in many of our schools, and just to watch and observe how things are growing in our district, and how people are working together, how students are together, and it's been frankly very reassuring to be able to do that and see how our staff are working with our students to keep them safe and follow the expectations of Vancouver Coastal Health and the British Columbia Centre for Disease Control. That at our high schools, and this would be Chattelich as well, the students are expected to be with their learning groups for meals as much as possible. There may be some exceptions that would be at the staff level that I don't know specifically, but that's certainly the expectation. At each of our high schools, and we don't have large high schools, we're around 500, just below for Chattelich and just above for Elphinstone. And that allows us to have cohort sizes and learning groups that are basically the grade levels that those schools are. And so there is a grade 8 hallway, there's a grade 9 area, there's a grade 10 area. And in general, students do stick together in those groups. Of course, there is some crossover, but for the most part, that's what it is, and that's what the expectation is at the school level. I wouldn't be surprised at all if some students from different grades, as they get out from the school itself, do get together. It's a social environment to be a teenager, and they do that. We manage everything we can within the capacity that we have to do that. So it's a continual piece that we will continue to monitor, with the expectation that if any student in high school who is not able to maintain distance from other people from the other learning cohorts, that they do wear a mask. That's the expectation. And again, we're doing the best we can to monitor that as we go forward.
Next question here is, why are masks not mandatory in elementary schools?
Right, so the discussion around masks in the school setting is actually very similar to the discussion about physical distancing. Because again, when you're in the same environment with the same people on a regular basis, the idea that a mask would protect you from COVID transmission is less relevant, because there is these other risks such as the surfaces. The other thing is that we do have concerns about the ability of children to safely wear and use masks, because masks make you touch your face more often. When you touch a mask, if you believe that a mask is preventing you from COVID, then there could be COVID on the outside of the mask from other people's respiratory secretions. And if you're touching that mask, then those secretions are on your hands. And if you're not washing your hands next, then you touch your face. And so, there's real concerns about children's ability to wear masks in a way that actually makes them safer. And I don't know about everybody else, but I've observed adults wearing masks in the community in ways that are incredibly unsafe. When it's tucked underneath their chin, where they're touching it, sometimes the nose is uncovered. Sometimes the masks that are being worn are cloth masks that look like they haven't been washed since the beginning of the pandemic. I'm not confident in the fact that these masks are protecting members of the public. And I believe that many of those same issues would apply even more to kids. There's no studies that show that kids wearing masks actually makes them safer. So of all the safety measures that are in place as part of school COVID safety plans, we believe that masks are actually the least important of them. And we're not confident that they would protect young children who may not wear them properly. And so, we think the most important parts of the COVID safety plan are the stay at home when you're sick policies, the screening for symptoms, the cleaning and disinfection protocols, and grouping kids into cohorts and things like that, so that we can manage exposures if they occur. So the masks are something that we think may not be offering a lot of protection. And when you apply them to young kids, we think that they actually could create risks.
Another question here is, why is Vancouver Coastal Health not reporting the school exposures? And why wouldn't everyone be contacted when our children are all using the same bathroom facilities?
Right. So, the first part about, there's been a lot of media about reporting of school exposures, and Vancouver Coastal Health is reporting school exposures, but we're not reporting on every case in the school setting. And this is consistent with what we do in every other setting and what we have done through the entire pandemic. When there's a case in a work site, or when there's a case in a public location, we don't notify everybody of that exposure. We notify the people directly who have been exposed. And in cases where we're not able to reach everybody directly, then we do issue public notifications around that. And we've had to do that very infrequently during the pandemic, because in most cases people can identify their close contacts. We're able to reach them directly, which is what we prefer, because then people understand their risk and understand what they have to do about it. And in those cases, then there is no need to tell other people that there has been a case in that setting, because they're not exposed. So them knowing that there's a case is actually not that helpful, because they're not at risk. And so that's the same approach that we're taking in the school setting. In the cases where we can reach that small number of people who are directly at risk, we will notify them directly, and we won't do any big notifications. Sometimes the school community is aware of those cases, and in those cases, sometimes the school district will make a communication to the school community and say, we are aware of a case, we're working with Vancouver Coastal Health, and we support them in making those communications. But if it's a small number of people that we're able to reach directly, we don't feel it's necessary to notify the rest of the school. The other reason we don't do that is because the information we collect under the Public Health Act is confidential medical information. And even revealing that there's a case in the school setting when only one person has been sick and now has been off, that actually does do something to their confidentiality, because many people will know who that case is. And what we've seen with other communicable diseases is if people are aware that when they test positive for a disease, that it will be, reported to the school community, they're actually much less likely to get tested. And so for this condition, in order for us to control it, we need people to get tested when they have symptoms and to trust then that we'll protect their medical information while we protect others through the contact tracing process. And so through that contact tracing process, we will sometimes have to notify that there are cases in order to protect other people. But if we don't have to do that, then we don't do it. And that's not a new way of working for Vancouver Coastal Health. That's in fact the way we've been working throughout the pandemic and throughout our history of managing communicable diseases. And so that's how we're continuing to notify around school exposures. There was a second part to that question.
Yes, about the contact tracing, why wouldn't everybody be contacted because everyone's using the same bathroom facilities?
Right, because we don't think that most people are acquiring COVID by sharing bathroom facilities. So we think that the most common way that people are acquiring COVID is through prolonged, unprotected, face-to-face contact up, over 15 minutes. And so that's the type of contact that we're really investigating. If a case says, well, I had a long contact in the bathroom with somebody and had a conversation, well, then that person will be isolated. But just the fact that they've used the bathroom, we don't think is reason to isolate somebody. Bathrooms, we have them actually to decrease the risk of COVID because although people can touch surfaces there, they are generally washing their hands after they go in there, and they may even go in there because they've coughed or sneezed on their hands and they need to wash their hands. And so, we don't think bathrooms increase the risk of COVID. We actually think they reduce it.
Next question was, in today's National Post, it was reported that a teacher in West Vancouver contracted COVID, and it was discovered that a student was confirmed to have the illness, but she wasn't informed while other students hadn't been informed. Doesn't this put students and staff at risk? So,
the information that's reported there is not completely correct. But we do have, and actually there's more than one situation where, the contact tracing process is not a perfect process. It relies on the information we get from the interview with the case, and then interviews with their contacts, and potentially collateral information that we get from teachers or school administrators or parents. So it relies on all of that information. For the most part, it does what we need it to do, but there can be cases that are, contacts that are not identified through that process. When that happens, it could be that there are two separate importations of COVID in a classroom, which is definitely possible. We're having a lot of transmission right now, or it could be possible that there is transmission within the classroom. But information about that transmission then informs our further public health action. And at that point, in this scenario, the entire class was isolated because it became obvious that the contacts that were identified were potentially not the only contacts. And so then, we take a broader measure. And that's the way contact tracing always works, is that you identify contacts. Hopefully the cases that occur amongst those contacts. If they occur outside of that context, then you need to isolate more contacts. And so that was done immediately in this case. And this all happened over a weekend. So it actually didn't result in further transmission within the classroom setting. The transmission that occurred prior to notification of these cases and could not have been prevented through the process of contact tracing.
There's some other questions regarding the bathrooms. And so this one states, what are the classroom restrictions? Why are the classroom restrictions less now than in June? For instance, they were all spaced out 2 meters in June and not now. Why not shut down the school the minute someone has COVID? And then another was around the bathrooms question, and given all the safety strategies, what's the difference between, how often the bathrooms are being cleaned with many kids per classroom using one stall touching door handles, toilet handles, and paper dispensers?
Okay, there's a few different questions there.
Sorry. Yes.
I think the first one is, I guess, comparing June to now. June was meant to be a bit of a practice time for the school COVID safety plan so that we could get some kids back into school and make sure that the COVID safety plans worked in preparation for the fall now, when there's a much higher proportion of kids back in school. I think Patrick was telling me the proportion that's back in the school district now. Maybe you want to share that with the audience.
Sure, I'd be happy to. So out of 100%, obviously, of all of our students, we have just under 1% are homeschooling. And that's when families make the decision to take complete responsibility for the education of their children. There's no, they're not required to cover the BC curriculum. They have strong feelings about how they'd like to educate their children, and they do that independently of the school district. Their responsibility is just to let us know. So that's less than 1% of our school district. And for reference, we have about 3,250 students in our district. We have about 5% of our families have chosen for their children to receive their education online through Sunshine Coast Online, which is the new online program that we've developed. And our staff are connecting with families right now to develop individual learning plans for those students. We've asked them to commit for the year because we have to hire staff for those positions, and we can't just hire staff and then let them go. So we needed the consistency of families making that commitment for that program. If there is space in their homeschool, they could choose to return to that if there's space in the classrooms. Unfortunately, we're not able to guarantee that as an option. So that's about 5% for online. We have, of the rest options 1 and 2, option 1 being back in class full time right now, that number is at about 83%. And as I mentioned before, I've been in the schools and seen that in operation. It looks great. Our staffing generally does allow for our classes to be below provincial averages. And so while we certainly do have a range of classrooms, if they were full, up to as high as 30, the vast majority is well below that. And the average is normally in the low 20s. And right now with that 83%, it's below that. And of course that varies from classroom to classroom and school to school. And so that leaves about 11% of our students' families have chosen to just wait for a little bit before they get comfortable with the whole process. They're watching to see what the numbers are. I've asked principals what are the reasons that the parents are providing for them waiting to return. That tends to be it. They just need a little bit more time to consider that. And for those families, we've provided learning packages that are developed by teachers in our district, and they go out every 2 weeks. And we are hoping that most of those people will return. Most of those students will return to school by November or so, because this is understood to be a transition program rather than a temporary or part-time teaching program throughout the year. So we'll continue to monitor that and see how it works out. But right now, those are the numbers. So just to reiterate that's 83% are in class, about 11% are using the transitions program, about 5% are Sunshine Coast Online, and less than 1% are homeschooling.
Yeah, so I think that sort of helps explain why things are different now than they were in June. There's many more students that need to be in classes, and then the other thing is what we were discussing before about physical distancing not being an important strategy within a classroom when you're spending a lot of time with the same groups of people. The other part of the question was, why not shut a school down as soon as there's one case? And the reason is because we don't think that is necessary. That's a very aggressive measure. It would cause harm to a lot of people because all of those kids would need to be at school. All of their parents would need to have to arrange childcare. They may not be able to work during that time. And it's just not, in public health, we always have to choose a measure that's proportionate to the risk. And that's what we saw during the first wave. We took very aggressive measures in order to, shut down transmission, across the region. But those measures cause a great amount of harm. And so we've realized that we can't do that during the second wave. We have to take more measured approaches. And now that we understand the virus better, we can take those measured approaches. And so basically, we don't think it's necessary to close down a whole school when there's a case. We think the best approach is to find out who has been exposed, isolate those people. If if that contains transmission, that's great. If we have to isolate a class, if we have to isolate a cohort, if we start getting cases through multiple cohorts and we think there might be transmission, then at that stage we do close a school, but we don't anticipate having to do that very often. But if that's what has to be done, then we will do it. But we need the evidence that there is ongoing transmission across the school and that everybody in the school is truly at risk for us to do that. Otherwise, we're unnecessarily isolating people, and there is harm to that. So that's why we don't close a whole school right away. You know, we do expect that there's going to be cases in the school system, because there are cases across this, you know, throughout society right now, and we're not going to eliminate those cases until, you know, we have a really effective vaccine, and that may be years in the future. So you know, we can't shut down every school just because there's one case, and it's not necessary. And then the third part of that question was about cleaning. And now cleaning is an important measure, and it does help reduce the chance of transmission, but no amount of cleaning will eliminate the possibility of transmission through surfaces, because you obviously can't clean a surface every time somebody touches it. That's just not a realistic strategy. So, you know, we want organizations like school districts to have a cleaning plan and to do regular cleaning with enhanced cleaning of high touch surfaces. And you know, that will help reduce the risk of transmission, but it has to be amount of cleaning that's manageable for the school district. We could spend the entire school district budget on cleaning, and then nobody would get any education, and we still would not eliminate the risk of COVID transmission through surfaces. So, you know, we really have to balance how much we apply of a particular measure, you know, acknowledging that it does help, but also realizing that on its own, it's not an effective strategy. So it has to be, you know, complemented with the other things in the COVID safety plan. I don't know, Patrick, if you have other comments about the cleaning that's happening in your facilities.
We're absolutely following the expectations that we've been provided from the Center for Disease Control to make sure that is very much in place. It's a lot of work for our custodians, and to make sure that that's covered, and we are actually hiring more custodians, and we're fortunate to have received funding both through federal and provincial funds to enhance that level of cleaning. So pretty much just following what you said there, Mark, is we follow those protocols and do our best to make sure that our schools are sanitized, acknowledging that as soon as they are, in many cases, another student is going to be there very shortly to touch something. That's the reality of a school. And we'll continue to be very diligent in following the expectations.
The next question is about filtration systems. The school filtration system uses MERV 8 filters, which are not sufficient to filter COVID. Has there been discussion to upgrade the filters to HEPA filters, which are known to filter viruses?
Yeah, so, you know, we have no evidence to suggest that, you know, the type of filter that you use would prevent COVID transmission in the school setting. We think that the, you know, HVAC systems that are in operation in schools, or the ventilation systems that are in operation in schools, if they are functioning adequately to maintain good indoor air quality, would be sufficient to do their part in terms of preventing COVID transmission. And, you know, although we have things like we recommend windows are open or whatever, we don't believe that windows must be open in order to prevent COVID transmission in the classroom setting. So whether the filters are MERV 8 or up to 13, it doesn't really contribute to preventing COVID transmission. You know, of course, we support the school district in over time improving indoor air quality for a variety of reasons, allergens, radon, you know, things like that, you know, wildfire smoke when we have events like we've recently had. You know, these are all reasons to improve indoor air quality over time. But the most important thing for COVID is that, you know, the HVAC systems in the schools are operating, that they're in good operating condition, and that the filters are clean and are being changed. And, you know, so that air is circulating, and, you know, that's all schools really need to do is maintain them in good operating condition. And that's what they need to do to prevent COVID, because again, the ventilation system on itself would not cause COVID transmission. And upgrading it to the max, level that you can also won't prevent COVID from being transmitted. Because again, most of the transmission occurs with close face-to-face contact, 15 minutes or more, and that's kind of transmission is going to happen regardless of what kind of ventilation system and what kind of filters are being used in a classroom.
I do have something I can add to that as well, Mark, if that's helpful. Our maintenance department has done some really great work around the HVAC systems, and it's far from my area of expertise to speak to it, but there has been a lot of work that's been done, including making sure that the sealing around the filters are in place to prevent air bypass, so that they are functioning as was discussed in the very best way they can be. We're running them 2 hours before occupancy and 2 hours after occupancy to make sure that all of our air is as fresh and ventilated as the spaces as ventilated as possible. They can be set to run with as much outdoor air as possible, and they are. The exhaust fans in the washrooms are running 24 hours a day. We are doing an early morning ventilation purge of all of the facilities, and I'm reading that, so I'd have to look for more expertise to understand what that fully means. But the intent is to clean out or provide fresh air for the entire building first thing in the morning. In terms of the MERV 8 filters, that's accurate, that our filters right now are MERV 8 or higher, and that we are looking into upgrading the filters for MERV 13 to see where or determining where they can fit. Again, that it's something that is beyond my technical knowledge, but they don't necessarily fit in all ventilation systems. But we are looking at installing those for not for COVID, but for overall considerations, including wildfire smoke and radon and things like that. So there are other things that we're doing, even looking into what the role of UV sanitizing lights are, and that applies to our electronic devices. Our technical department has looked at and purchased some devices for sanitizing our laptops in some situations. We're trying that out to see how well that works. So we're actively looking at whatever we can to make sure that our environments in our schools are as clean as they possibly can be.
Next question is, both my children caught a cold the first week of school and had a negative COVID test. Given all the safety strategies, I'm discouraged they caught something so quickly. What's the difference between the spread of COVID and the spread of the common cold?
Well, the common cold is not a single disease. It's a whole bunch of viral diseases. And so it's actually difficult to comment on that. And some of those diseases, we actually don't know how infectious they are. It's easier to, I guess, compare COVID to kind of viral diseases that we do know how infectious they are. So like influenza or measles. And, so COVID is more infectious than influenza, for instance. And also because influenza the risk can be reduced through immunization and things like that. But COVID is much less infectious, for instance, than measles, which is spread through the airborne route. So, COVID, we do know of more infectious diseases, but things like the common cold are probably more contagious because whenever condition causes very, very mild symptoms, it can spread quite easily because people don't get laid up in bed when they're sick, because when they're laid up in bed, it's hard to transmit it to anyone else. So if there's a disease that just causes runny nose, then it does transmit quite easily because people tend to be out in public with runny noses. So, so that's kind of the difficulty. I guess maybe we could talk a little bit about, symptoms and when people need to be tested, and because we have recently had some changes to the guidelines with that, and I wanted to go over that a little bit. There's quite a long list of symptoms that you can be tested for COVID with. There's the BCCDC pediatric guidelines, and they list all the symptoms that could be suggestive of COVID. And so people can get a COVID test, or children can get a COVID test if they have any of those symptoms. But we know that most cases of COVID don't present just with the mild symptoms, for instance, runny nose or sneezing. Most cases of COVID, might have runny nose, but they would also have cough and fever. That's much more likely to be COVID. And so we've changed the way that screening is done for school. And we've said that, you know, if kids have one of these key symptoms that are things like fever, cough, shortness of breath, diarrhea, I think that's the main ones on the list, you know, kids do need to be out of school. And if they persist for 24 hours or one of them is fever, then you need to be tested for COVID. As opposed to if you have any of those symptoms, you know, runny nose, sneezing, itchy eyes, things like that, that used to be said you have to be out of school and then you have to be tested for COVID. So we've tried to introduce a more focused list that would mean that kids won't have to be out of school as much because of symptoms like runny nose, but at the same time, you know, will get tested when they really are at high risk of having COVID. And we've also introduced that period of time, that 24-hour waiting period, so that if a kid coughs one day, goes home and isn't coughing after 24 hours, they could go back to school because, you know, that probably wasn't COVID. But if they cough one day, they go home, and the following day they develop fever and shortness of breath, well, then obviously they need to be tested. It used to be in the guidelines also that you had to stay off until your symptoms resolved, even following a negative test. And we thought that also unnecessarily kept kids out of school. So like in this question, if somebody has a negative COVID test, now they're able to return to school as long as they feel well enough to be in the school setting and as long as their fever has resolved. So that's a little bit of change to the protocol as well, because, you know, once people have had negative tests, we want them to get back in school so they can keep learning. Yeah, maybe on the same topic, because I can see the next question. What if one of my kids has flu-like symptoms and the other one has no symptoms? And do I keep them both at home? So the only time you have to keep kids at home is if they are symptomatic. So if they have one of those symptoms that's in that list, then you have to keep kids home. Or if they test positive for COVID and they're directed by public health to be kept home, or if they're a contact of a case of COVID and they're directed to stay home by public health. So those are the only times when a kid has to be home from school. So the kid with symptoms definitely has to be home from school, but their siblings do not have to be home from school unless that kid tests positive for COVID. Then they become household contacts. You'll be contacted by public health, and the siblings, as well as the parents, will be directed to isolate. So, you know, isolation is a big imposition on people, and we don't expect people to have to make that decision on their own. Whenever somebody needs to be isolated, public health will contact them and will inform them that they have to isolate. Likewise, if a parent has symptoms, they don't have to keep their kids at home, but if the parent tests positive for COVID, then we will contact you, and then we will tell you to keep your kids at home because they are household contacts of a case. But again, you don't need to make those decisions on your own. You'll be directed by public health to do that. And I think there's another question similar to that here. If a parent has to travel out of country and upon return has to quarantine, does the kid continue to go to school? And yes, the kid does continue to go to school because it's the parent that needs to quarantine, and they are not a case. They're basically like a contact, but the kid can go to school. Now, if the parent becomes symptomatic, the kid can still go to school. If the parent becomes symptomatic and tests positive for COVID, then public health will contact that person and tell them to isolate, and will also isolate their household contacts. And at that point, the child can't attend school. So that's the sort of the process. It's all those questions are sort of related, but as I said, if somebody needs to stay home from school, they'll be directed to do so by public health because that is a serious imposition on their freedom.
The other question here, it may relate to an answer you've done earlier, but at Chatlash, they are closing most doorways to the school and giving each grade only one doorway. However, in practice, this adds a large amount of crowding in the halls where physical distancing is impossible and we are potentially exposed to anyone in school. Students could otherwise get between classes outside where distancing is much easier. Do you think the benefits outweigh the losses here?
I'm having a little bit of difficulty understanding the issue, but what I'll say with COVID safety plans and things like you know, single use of doorways or directional stairwells or hallways is that, you know, a lot of places have never done this before, and so we don't know the best way to do all of these things. And so I think, you know, we've had to do our best with establishing what we think would be the safety plans, and if we implement certain things and then, you know, you see maybe this isn't working right, then, you know, provide that feedback and it can be changed. Because although we want, you know, we want people to be physically distanced, but if something happens where people come within 2 meters of each other, that the world hasn't ended, and likely COVID transmission has not occurred during that event, you know. And so then we have the opportunity to say, okay, well, actually, let's try this a different way, you know. And we want the COVID safety plans to work best for everybody. And so if you have a better idea of how students could get around, then I would suggest, you know, letting the principal know that, and they can continue, and maybe that could be trialed. And if that's better, then that's better, because I think everybody does want to reduce the risk and also have good ways of getting around. So, you know, I think we have to learn the best way to do things. So I can't tell what is the best way based on that, having not been to the school and things like that. But I think, you know, we all want to learn the best way to get around schools.
I will add to that as well that all of the schools have very different scenarios, and they've worked very carefully with their staffs to consider what the best processes are. And as Dr. Leschisman just said, that finding the best way sometimes is a trial and error. You do everything you can based on the structure of your school and where the doors are and where the different learning cohorts are, and make some decisions. And then you say, well, that maybe didn't flow quite as well as we hoped it would. And a group is interacting with another group or something like that isn't ideal. And potentially in this case, because you mentioned outside, that perhaps there's an issue with weather from time to time as well, that on a nice sunny day, it's pretty easy to congregate outside, not so much on a day like this where we had some pretty heavy rain showers. And so finding those balances and certainly planning very carefully based on what we know, and then adjusting as we go along is an important part of this. But your question has made me very curious to double check on this. So I'm curious. So I'll take a look.
So I can see a question here. If somebody at a house tests positive, since it is so contagious, why would the direction be to send kids in the same house to school? So no, that's not the directive. If somebody tests positive for COVID in a household, public health will contact that person, tell them to isolate, and will also isolate all of their household contacts. Those are the people at highest risk of getting COVID, and those are the people that we always isolate. So yeah, maybe you misheard me before, but so household contacts of a case are always isolated. Another question around testing that also has come up in many of these forums is the new sample type that is starting to be available for kids. You know, up until this point, we've been using the nasopharyngeal swab to test people for COVID. And it's basically a brush that's inserted through the nose to the back of the throat and then twisted for several seconds. And people have referred to it as the brain biopsy and things like that. It's not a pleasant test. And you know, certainly once kids have had it once, they don't want to have it again. And so, you know, the province has been working really hard to implement a new sample type for kids. And now the saline gargle is starting to be available at testing sites for kids. And so that's a little vial of salt water, saline, that gets put into the mouth. You swish it around, you gargle around, and somebody sort of coaches you as you're doing this. And then you spit it back into the tube, and it can be tested, and it has similar sensitivity to the nasopharyngeal swab. So that's a new sample type that's available. We think it's much more palatable for kids. If they're sick and they require hospitalization, they can't have that type of test done. But if they're, you know, outpatients in the community, that's a type of test that's now available at the COVID testing centers. And so we think that particularly for kids that might get symptoms quite a few times over the school year, this will be a better and more acceptable way to be tested. So that's also just available now.
Next one was, will vaccinations become mandatory when or if they become available?
So that's really difficult to know. I mean, I don't think we would ever have a program of mandatory vaccinations for all members of the public. That's not how we administer any vaccinations, really. You know, first of all, we'll have to see which vaccines become available. We'll have to see how effective they are and who they are most effective for. There's a good chance, if they're effective for the groups at highest risk of bad outcomes for COVID, that we'll you know, want to give the vaccines to those groups, like people in long-term care facilities. They're the majority of the people that are dying of COVID. And so we would want to give it in that setting. We probably also will want to protect healthcare workers and essential workers so that they can continue doing their work despite potential risks. But it will really depend on, who the vaccine works for, how much vaccine we have available, and, so all of those considerations. There's also a lot of considerations around the influenza vaccine this year as well, because the symptoms of influenza can be confused with the symptoms of COVID. And so we're really hoping that people will really get the influenza vaccine this year. And we're recommending it for everyone, even though it's not totally covered for everyone in BC. And we're planning mass clinics to administer the influenza vaccine, because we know that people might not be able to get it in family doctors' offices this year because of restrictions around, numbers of people that can be seen there. So, we don't know what's going to happen during the flu season, but we want as few people as possible to have influenza-like illness so that it's not confused with COVID. And so, we will be running mass clinics to do that. And hopefully that will also be the model by which we can give the pandemic vaccine when it comes available. Right now, we're sort of planning for it to become available in early 2021. But, there's a lot of kind of things that still have to fall into place before we know if the vaccine will be available and how effective it will be.
Why are we told to keep our social group small, like 6 people, but that doesn't apply to schools where kids have 60 people that they're around? We can never know who the cohorts are seeing or what they're doing outside of school. Just curious.
Yeah, so the cohorts aren't really the same thing as the bubble. So the bubble are your close social contacts, the people that you are regularly in contact with, like your family members and a few close friends and relatives. And so those are the people that basically you're not really maintaining physical distancing from, and that you're accepting that if there's COVID in that bubble, that you'll probably get it as well. The cohorts are not the same thing. People are supposed to try to still take measures to prevent transmission that might occur, to the degree that they're able between people in the cohort. The cohort is really a tool that we can use in public health to limit the number of people that we might need to isolate. And, like I explained before, we won't automatically isolate a cohort. We're going to figure out if everybody in that if there is a possibility that everybody in that cohort has been exposed. And if there is, then we would have to isolate the cohort. But before doing that, we're going to hopefully identify the few key people that have been exposed and then isolate them. If that's not possible, then we would do the class. If that's not possible, several classes. If that's not possible, then we go to the cohort. So it's a strategy to limit the amount of people that need to be isolated if there is, if there are exposures in the classroom. So it's not really the same thing as the bubble, because everybody will have their bubble, but they'll also be part of cohorts. But they're already parts of cohorts, because the parents are part of cohorts at work, essentially, where you work with a certain amount of people on a regular basis. Kids may be going to activities like sports or dance or things like that, where they're part of cohorts there too. So we're all part of cohorts in society, and the school cohort is just another one that kids are part of. And so just because there's a case in a cohort in a school doesn't mean that the child will get it, because they're not in close contact with everybody in the cohort. Unlike their bubble, where they are in close contact with those people. So that's sort of, they're slightly different concepts.
This final question has about that the government website says that if someone in the household has COVID-like symptoms, the child can still go to school as long as they're not showing symptoms.
Yeah, that's right. So if the child is not symptomatic and nobody in the household has tested positive for COVID, then the child can go to school. But when that changes is when the person who has symptoms tests positive, then both that person and the child cannot go to school, and they'll be directed to isolate by public health. But just because somebody in the household has symptoms does not mean that that person has COVID. In fact, even at our COVID testing centers, now that we're seeing a lot of community transmission, only 2% of COVID tests are positive. So most of the people presenting even to testing sites thinking they have COVID actually don't have COVID. So, just because you have somebody in the household who has symptoms doesn't mean that they have COVID. And as long as the child is well, even if they had COVID, they would obviously haven't transmitted it to the child yet. So, that's why the kid can go to school. And then if the person tests positive, then the child needs to stay home. But at that point, they still haven't developed COVID. So because there's this incubation period between one case and the next, that's what allows us to not have to isolate everyone who has symptoms, but we can start the isolation processes once somebody tests positive.
And so that's the last call out for any questions. Are there any common questions that you wanted to address in our last couple minutes?
I mean, I guess another question that comes up quite a bit is, you know, some children have medical conditions or immunocompromising conditions, and parents want to know, is it safe for them to be in the school? And one of the ways that I like to think about that is, you know, these COVID safety plans are meant to protect everybody in the school system. COVID is not a, you know, is a low risk disease for kids. You know, it's probably less harmful to kids than influenza. And so if the child could be in the school system during influenza season, it's likely safe for them to be in the school system during the COVID pandemic. And so I think that's a good way of thinking about it. Now, obviously, each child is different, and they should talk to their physician about, you know, about their risk, because, you know, every situation is unique, but I think that's a good way to think about it. And likewise, people often have questions about, well, what if I have vulnerable people in my bubble? Is it safe for a child to go to school? And so each family is going to have to make a decision about that, because it will depend on the vulnerability of the people in the bubble, but it will also depend on the family's tolerance for risk. Some people are willing to accept quite a lot of risk, and some people are not. And so, you know, these are discussions that, again, can be had with the family physician, because they'll understand the medical complication, the medical conditions involved. But, you know, we believe that for most people, it is safe to have kids in the school. School is actually a low risk environment in terms of COVID transmission, because kids are less likely to get COVID, they're less likely to be involved in transmission. And so we don't think having a kid in school actually increases the risk to others in the family. So maybe just in terms of kind of, I guess, wrapping up some closing comments, we're really happy that schools are back in session. We think it's super important for the social, emotional, physical development of children. And we think it can be done safely in the context of the COVID pandemic. And we're kind of looking forward to working with schools through this process, just like we work with schools through the process of other communicable diseases, and it usually works quite well. So yeah, so very glad I could be here today, and hopefully, hopefully we were able to answer your questions.
Thank you very much, Dr. Leshishin, for being here with us. It's so important to have the expertise of your expertise and of Vancouver Coastal Health and the Ministry of Health to guide us through this pandemic. It's something that we're all learning about as we go along. I do want to let and remind anyone who's watching this that we have fantastic resources available for more information on our website. You'll see a banner right across the top of our Facebook page that has a frequently asked questions place in there. And on top of that, if you have any other questions, then please do send your questions to questions@sd46.bc.ca, and we will absolutely get back to you as soon as we can. So thanks very much to everybody who was able to listen in on this. Dr. Leshishin, thank you very much. And Stephanie, thank you very much for coordinating this for us.
Thank you. See everybody later.
Thank you. I'll post the recording for everyone. Thank you.
Thank you.